I'm now president of TADS, Taiwan Association for Dental Sciences, since this year. This is a photo taken with Dean Brief, Dr. Brief, and Dean Dr. Will. And this is my PhD article. And the title is called The Most Appropriate Position and Number for Absolute Anchorage for Orthodontic Tooth Movement. And I'm the first author. And this article has been ranked #1 in the world in 2013. And I'm now president of TADS. This is a top position of Academy in Dentistry in Taiwan. And this is our mascot, TADS, and holding a small Taiwan. Very cute, right? And we also have a very prestigious journal of dental sciences with a very high impact factors. So you're welcome to submit your articles to our journal. Okay, let me briefly introduce Taiwan. As you know, Taiwan is located here, east to Pacific Ocean, and here. Okay. And speaking of Taiwan, I think most of you will think of TSMC, a semiconductor chip manufacturing factory, and a bubble tea, just like this. And also you might think of Taipei 101. And there's an American rock climber called Alex Honnold. He climbed all the way up to Taipei 101 a few months ago. So still you can watch it on Netflix. Very terrifying. Okay, now I want to introduce the city that I'm living in, Taichung, Taiwan, which is the second largest city in Taiwan. Okay, now I would like to show you a video. Sorry, technical problem.
At sunrise, the sea laps softly against the shore, as she has over the past million years, awakening the land. Situated in the heart of the island, Taichung is protected by the Shuishan Range, which shields it from Pacific Ocean storms in summer and from northeastern monsoons in the winter. As a result, Taichung enjoys a delightfully mild climate all year round. While an outward migration away from urban centers remains a common trend, Taichung is among the few cities in Taiwan blessed with a growing population. This has also helped it to become Taiwan's second largest city. Taichung is the heart of Taiwan. Situated in the middle of the island, it has an airport, as well as a harbor. Visitors and goods travel through these ports, connected to two highways, the Taiwan High-Speed Rail and Taiwan Railway. From the north to south, Taichung offers conveniences superior to other cities.
And this video is in Chinese.
这栋新大楼还没有完工，上面有一个大大的眼睛造型，设计理念令人好奇，也被网友拍照 PO 上网，引发高度讨论。台中河南路跟经贸路口，也就是水南经贸园区，出现了这栋新颖的建筑，有12层楼高，大楼外观仿佛睁开了一只眼睛，相当引人注意。
有点像眼睛，新的想法吧。
我们会害怕。 不知道他给我感觉的建筑
像一只眼睛在看你，是不是？
对，不太舒服。
是破掉了，就是觉得会蛮有一个有设计感的建筑物啦。
Okay. Okay, now actually Taichung has the most wonderful weather in Taiwan, so I like to live in Taichung City. Okay, Taichung is situated in the west middle of Taiwan, as you can see just right here. And Taichung City has been selected as world's best art city in 2007 and world's most intelligent city in 2013. And actually next to Taichung City, we have a very beautiful lake called Salmon Lake. And if you are here, you can pay a visit to there. Okay. And now I would like to introduce our university, Taiwan China Medical University, abbreviated to CMU, and our School of Dentistry is located on the 13th floor in this building. And we also got #1 in Taiwan with the largest amount of grant from the Teaching Excellence Project from the government. And we are also top 100 universities in Asia. And for total ranking, university ranking is #2 in Taiwan, private school #1, and medicine in #1. And this is based on an accreditation in 2013. And this is our new campus, called Shuinan campus, just as you see on the video, big eye here, and a night view. And this is our CMU research building, like this. And another museum is under construction and due 2028, CMU Museum. And this is our university chain, okay, is a system. And our CMUH hospital just passed the CCI, International Medical Accreditation. And we also got selected as the world's best hospital and world's best smart hospitals. And this is our medical system all around Taiwan, as you can see, all over Taiwan. And actually, our headquarters is in Taichung City. This is our headquarters and where our course is going to be held. And this is our Wuchen Hospital area. As you can see, on top of this building, we have a heliport, and which is ready for emergency medical ranking. Okay, and we also got the Medical Service Award, first award. And actually, in our university, we also have very interesting features. We have Chinese medicine, Department of Chinese Medicine, which is also the only one in Taiwan. And therefore, we can conduct a lot of research combining orthodontics and acupuncture. It's very interesting. And also Department of our dentistry. Okay, our group photos, like this. And this is our clinic. And actually, last year, 2 years ago, we moved to a new building. This is our dental clinic located at the 5th floor. And our group photos in the new building. And this is our logo, Department of Orthodontics. Okay, now I want to introduce to you what epoch orthodontics is, and together with our invention, Kenko implant. And epoch, actually, it is also called ISW, which is a nickel titanium wire developed by Institute of Science Tokyo. And this is my invention, Kenko implant. I will call it KI. Okay, but low hysteresis is abbreviated into LH. This is an abbreviation. But whenever you see LH, always remember it is the same with ISW, improved superelastic titanium nickel alloy wire. This is the same. So if you look into some old articles or journal, please use both words, because sometimes you cannot find by LH, but you can find it by ISW. Okay, so LH means low hysteresis, but why it is so useful and so wonderful in our treatment? Let me show you. And here is a handout for LH orthodontics treatment. So if you can, have a clip, you can just, have a screen capture here. Okay, every year I take my students to Japanese Orthodontic Society for some publications, and this is our photos. And we have a lot of publication about epoch orthodontics and its associated treatment. And last year we had 19 publications. Okay, we also got a lot of excellent exhibition awards from JOS. Okay, now I want to briefly introduce epoch to you. Okay, whenever we start with an orthodontic treatment with arch wire, first of all, we will bond bracket on the buccal middle surface of the tooth. This is the first stage. Okay, and after that, we will insert an arch wire into the bracket slot. I think everyone knows this. But with the temperature in our oral cavities, and all the wire can be restored to its original form, which I mean a straight wire. And by doing this, all the teeth can be moved smoothly to a well-aligned position by an arch wire. Okay, so this is the basic concept. So whenever you engage an arch wire into the bracket slot, we call this phase loading phase. But when the arch wire can be affected by the oral temperature, which I mean 60.75 Celsius degree, and the wire will restore to its original straight wire form, and all the teeth can be moved okay, like this. So the upper part means the engagement forces, and the lower part means the tooth moving forces. Okay, but what is hysteresis, which means the difference between the loading? Like this is the engagement for lattice, and this is the restoration of the wire to the original straight wire system. But in Japan, they want to lessen, they want to shorten this range. So therefore, they try a lot of methods to shorten to change the properties of this wire to make it very, very small, which we call low hysteresis. This is why we call low hysteresis. Okay, but actually, low hysteresis means constant forces, which means no matter how hard you bend the wire, you make a lot of deflection of the wire, all the forces on the teeth can remain almost the same. This is the true meaning of RH wire, and this is some experimental data, as you can see. Okay, so RH means, to my surprise, when I touch this RH orthodontics, I never get hurt by bending some arch wire like stainless steel wire. Okay, so this is RH. Always remember RH equals to ISW wire. Okay, so it goes through 2 steps of heat treatment, and they change the proportion of the atoms. They change the titanium nickel from 6A to 51 to 53 to 47, and therefore we call it titanium nickel wire. Strictly speaking, we have to call it titanium nickel instead of nickel titanium. Okay, so again, RH means ISW, and it is a titanium nickel alloy wire. So whenever you see titanium nickel, please remember it means RH wire. And in my memory, I think that RH wire is the only titanium nickel wire in the world nowadays. Okay, so these are some articles published by my teacher Kunimichi Soma and the inventor Otsubo Kunihiko, and you can see they use ISW instead of RH to have some publications. And whenever you see ISW and titanium nickel, okay, always remember it means RH wire. Okay, so they also perform a lot of experiment, and I think RH wire is one of the most precious metal arch wire used in our daily clinics. Okay, and there are a lot of experimental data. I will skip it. Okay. But what's the important notes with regard to RH wire, which means RH always exerts constant orthodontic forces. This is the most important main concept, not to be influenced by the intraoral temperatures, because the low hysteresis is very small, and therefore RH can exert very light orthodontic forces near the feeling of bending. So you can think it is very soft and light. And arch wire friction is limited to the smallest because of the very smooth arch wire coating. And if you want to bend RH wire, which is also feasible, but you have to use a machine we call heat bender. The commercial name is called Sora X, and you can use a heat bender to change the shape of RH wire without deteriorating its mechanical properties. Okay, so this is RH wire and its development. Okay, so always remember RH wire is also called one arch wire method. Why? Because when we use RH orthodontics technique, we almost use no round wire. We don't have any round wire. We only use RH wire, a rectangular wire, from the very beginning till the end of the treatment. So we call it one arch wire method, which is a very important characteristic of RH orthodontics. Okay, but you must be curious about why we don't use round wire. Our teachers always teach us to start with round wire, because round wire cannot do toe control. And if you want to do control, we always prefer using rectangular wire. And that's the reason why we don't want to use round wire, because if RH wire can offer the flexibility of round wire, also can exert the toe control at the same time, we don't have any reason to use round wire anymore, and which is a very, very big advancement in the orthodontic treatment. Okay, so let's look back to the bracket. Actually, we have the O1A system and O22 system. I think everyone knows this. Okay, O11 means O1A means the opening of the bracket. Okay, but RH wire goes best with 016 by 022 wire size dimensions and goes best with the O1A bracket slot. Okay, so you can see the cross sections. Okay, if you use round wire, which is not RH wire, okay, RH have no round wire. So RH wire have 016 by 022 and 018 by 025. But mostly we enjoy using 016 by 022 because it's more flexible. So you can do leveling and torquing at one time. I will explain it later. Okay, so we mostly in Japan or in Taiwan, we use 01S bracket slot, goes with 016 by 022 and 018 by 025 wire. and which can exert the full total control for our treatment. Okay, but there are some special situations that I prefer using round wire. For example, for an H2H patient. Why? Because for H2H patient, you can see we want some minor anterior teeth leaning forward, leaning lingually. Okay, so that's the reason, tipping lingually. So that's the reason why we use round wire, which is more easy for the control of the teeth. So in this case, for an H2H patient, I suggest the usage of the combination of upper rectangular wire and lower round wire. Okay, so in our clinic, I always suggest that you can prepare 016 by 022 many, and for the rest of the dimension of the arch wire, you can save one for a rainy day. Okay, they are hardly used. Okay, so there are some commercial package for this. Okay, when I was an intern student, in my memory, our teacher always used this straight wire. And every time when my teacher want to, shape a arch form, he will ask me to take out one piece of arch wire, and then he will make the straight arch wire and turn it into an arch form. Which was really amazing. Okay, but as you can see, nowadays we don't really bend the arch form by ourselves. So we can have some commercially, offered preformed arch wire like standard and AQ form. And what's the difference between AQ and standard? Standard form is more for Caucasian people, and AQ form is more for Asian people. So you can use AQ form for the Asian people's treatment. Okay, but to my curiosity, when I was a student, my teacher used to use this arch form template to teach us how to form an arch form. But I was always, thinking this is unreasonable. Why? Because, no one share symmetrical arch form, right? And who are these arch forms? These arch forms are who has this arch form? We don't know. And therefore, which is unreasonable in my opinion. But for LH wire, you don't have fixed arch form. As you can see, LH wire, you can extend the arch form just wider or just narrow. So, okay, it can allow a lot of different shapes of arch. And this is the main reason that I like LH so much. Why? Because every time when I, was an examiner and I asked my students, how do you decide your arch form in your treatment? No one can answer. So the best answer is abide by the physiology. If we don't know how to, decide the arch form of the patient, why not we show respect to his physiology? Okay, so that's the reason why LH wire is quite good. Why? Because it don't have a fixed arch form, and it can allow the teeth to be well aligned, but with a very mild forces, and which is very reasonable in my opinion. Okay, so I like LH orthodontics very much like this. It can offer what we call individual normal occlusion. All these cases are the cases of LH wire. You can see the arch form are totally different, respecting the individual differences. Okay, and which also assure a better stability after the treatment. Okay, so LH wire has some characteristics, including shape memory, super elasticity, shock and vibration absorbing property, and so on. Okay, so you can see LH wire is very flexible, and don't forget it is a rectangular wire, so you can always do leveling and torquing from day one. Okay, like this. Okay, you can do one arch wire method and together with day one torque control in your treatment. And also we have a lot of experiment about the low friction features. So you can see low friction characteristic of arch wire can greatly reduce the friction between the arch wire and the bracket when teeth are sliding, which is quite good because we can move the teeth very efficiently and effectively. Okay, now I want to show you some videos, illustrating our vibration situation. Okay, let me show you. For example, this is commonly known stainless steel wire. Whenever you touch the wire, you can see the vibration all along the arch wire, and there's a fixed arch form, right? Okay, let me show you another one. This is called copper nitride. Also the same. If you touch it, you can see the vibration goes through all the wire, and it has a fixed arch form, just like this. Okay, let me show you another wire. We commonly know TMA. Also the same. If you touch it, and you can see the force is transmitted through the arch wire, and it turned into a fixed form in the end. Okay, but if you see LH wire, oh, you can see there's no vibrations and no fixed arch form. Let me show you again. No vibrations and no fixed arch form. This is the main characteristics of LH wire. Okay, let's go back to the slide. Oh, sorry. My apology. Sorry, I accidentally touches the close button. Okay. Okay. Thank you. So can you see? Okay. So these are some experiments about the shock and vibration absorbing property of LH wire. As you can see, LH wire can absorb most of the shock and vibration. Okay. Even they have performed some animal experiment, you can see the resorption is very, very less. Okay. So if you see LH wire, titanium nickel, you can see they can produce far less damage to the PDL wire, PDL ligament. Okay. Okay, so we also have some small gadgets to go with LH treatment. The first one is what we call crimpable hook, just like this, and crimpable stopper. We will use this to extend our arch length, or we can invent or design a lot of very interesting treatment concepts. You can see this is what we call crimpable hook and crimpable stoppers. And they can be firmly fixed on the LH arch wire. Okay, and if you are not pleased with the position, you can adjust the position of the stoppers by 2 pliers like this with the leverage. So you can change the position of the stoppers. So it become very flexible and versatile in your treatment. Okay, so we also have some open coil spring, which is nickel titanium materials, and therefore we can also exert constant forces. Like the most commonly used is the blue. It exerts 100 grams of force, and yellow is exert 115 grams of force. These two of the most commonly used open coil springs. Okay, with open coil spring, what can we do? Actually, we can do distalization very, very easily. In the past, when we want to do distalization, what we should do? We will take out the wisdom tooth first, and then we can simply combine a stopper and an open coil spring. And with this, we can tie the anterior teeth together as anchorage. Of course, you can use an IME intermaxillary to reinforce your anchorage. But with this, we can do distalization very, very effectively. But in my opinion, I always ask my students to do distalization one-on-one, not to push 2 teeth at one time. Why? Because if you want to do distalization, if you deal with only 1 tooth, which is very easy, and you can have less anchorage design, you can make it very, very efficiently. Okay, this is my opinion. So this is an example. We want to move this tooth backward. So we use a combination of stopper with an open coil spring, and this tooth can be moved backward like this. And then when they touch together and form molar class 1, we can tie them together as an anchorage, and then you can do the following. Okay, and the reason why it is called constant force coil spring, here are some experimental data for your reference. They can exert almost constant forces like 150 grams or 100 grams of force. And on the other hand, we have also closed coil spring like this. Also, the most commonly force are 100 grams of force blue and 150 grams of force indicated in yellow like this. Okay, with closed coil spring, we can do canine distal drive very efficiently. In the past, we have a lot of methodologies to perform canine distal drive, but in the world of LH wire, we just simply use constant force coil spring, and it can exert very constant force to move canine backward. And then you can see from the parietal gingiva, all the canine can be moved very, very smoothly and bodily. Okay, this is a typical way that we do canine distal drive. You can see we only use a section of a closed coil spring. forces of 100 grams of forces and just tie it, pull close and tie loose. And there are some technique I will show you in our lectures. Okay, so for anchorage control, we only tie the posterior teeth together. Very simple, right? Okay, this is the original shape of the cross-coil spring like this. Okay, so now I want to show you another secret of RH wire. Every time when we use RH wire, as you can see, we just engage the arch wire into the bracket slot. But with the effect from the intraoral temperature, all the wire can be restored to its original, which I mean a straight wire. So by doing this, we can perform the leveling technique or the process of the orthodontic treatment. Okay, so now you know this. I want to share with you two main kinds of leveling. The first one is what we call all tie situation, which I mean you tie all the teeth very, very tight for local expansion. But for the other situation is we want to move these tooth only, but you want to bring any inferences upon the adjacent teeth. So in this case, we will use RH wire here, but we will tie here and here very loosely. With this, as RH wire is going back to a straight wire, you allow the rooms for the sliding, and you can see after the alignment, the adjacent teeth A and B still stay in the same original place, right? So this is another technique we use very often, especially for impacted teeth. So this we call two loose one tie, two loose one tie. Okay, so for local expansion, what we tie? We will tie all the teeth very tightly. Okay, for local expansion, because all the wire can be restored, and as long as you can do this, you can do expansion very, very effectively. Okay, like this, because all the wire has been elongated. So when it comes back to a straight wire, you can do enlargement or expansion very, very naturally. Okay, so this is another example when a tooth is moving along the arch wire. In the previous case, this we call all the teeth can be moved with the arch wire. But in this case, we know canine is moving along the arch wire. So in this case, we want to lessen or decrease the friction as much as we can. So we want to tie them loosely so that we can reduce the frictions along the arch wire. Okay, so this is also another example when we want to deal with some impacted canine. And then when we adjust the crown of the canine to a relatively good position, and we make sure that there is enough room for this tooth, and please pay attention to the next step. And as you can see, we can engage RH wire directly into the bracket slot, and you can see the arch wire end. If you allow the arch wire end to go posteriorly smoothly, which I mean tie them very loosely, you can use RH only to bring down the impacted canine into the occlusion. Very, very simple, very, very simple. So we can adopt this kind of methodologies to deal with all kinds of impaction tests. Okay, I will show you more cases later. Okay, so we also know how we deal with the extraction case. The first reason is we want to deal with the protrusion cases, like this. And the other situation is we want to avoid the protrusion after alignment, and therefore to eliminate to do the declouding, we only take out by the cuspid, and then after we level all the anterior teeth well aligned, we make all the anterior teeth well aligned, we will do mesial drive of the posterior teeth to close up all the spaces remaining. Okay, so there are two main stages. Okay, but when I was a student, my teacher used to teach us there are 4 steps you have to abide by. The first one is to leveling and alignment, and the second stage is to do canine distal drive to make sure there are enough room for the anterior teeth retraction. And the third one is what we call space closure, including 2. The first one is for protrusion cases, we do anterior retraction, and the other one is to close up all the minor spaces for the crowding, which we do mesial drive. This is the third step. And the fourth step is what we call ideal arch. We can do some finishing and detailing. Okay, but nowadays in the world of RH wire, we can combine 1 and 2 at the same time, and we also combine 3 and 4 at the same time. And therefore, with RH wire, when you are dealing with extracting cases, you should only do 2 things. The first one is leveling and canal distal drive at the first day, and then you can finish the case by space closure and together with ideal arch. Okay, and we also have an arch curve, like you can see just like this, and this is quite useful to treat the defect cases, to correct defect cases. Okay, and I will show you the reason and the mechanism in my courses. Okay, and this is the other technique we call arch melt technique, which is also very effective for open bite treatment, like this. And except for open bite treatment, as you can see, it can correct the occlusal plane, and therefore it is also very useful for the occlusal canting corrections. Okay, so let me have some summaries. Advantage of arch wire in a nutshell, we can know it by one arch wire method and the day one torque control, and it can achieve individual normal occlusion, and it can design a very dynamic anchorage with hook and stoppers and some others. Okay, and in arch orthodontics, we use almost no tests and no back turbo. Okay, so this is what we call expansion arch, and we can do pinpoint specific expansion in arch wire. But of course, you have to use the heat bender to bend the arch wire without deteriorating its material properties. Okay, like this. If you want to expand only one section or one portion of the dentition, you can bend the arch wire like this, and then you engage it back into the bracket slot, and with the restoration of the arch wire, all the designed sections can be expanded very naturally. Just like this case, a facial asymmetries, but we hold strong doubt about these two teeth showing some interference here. So we only bend the arch wire like this to move these teeth outward, and then you can correct the interference very, very easily. That's like this. Okay, so I want to move on to the rotation, which is also a very powerful technique when we use arch wire. In the past, when we want to deal with rotation tools, my teachers used to teach us force couple, which means equivalent paired forces in opposite direction like this, and it can produce an effect of rotation in press. Okay, so my teacher used to teach us to have some lingual button, and the mechanism is we pull one side backward and one side forward, or like this, one side this, one side this, or one side this, one side this, or one side this, one side this. Okay, just like this. But what if we don't want to have any materials in the lingual side? What would you do? Okay, let me show you one example. If this is the case and we want to correct these tools, rotated tools, what would you do? Okay, so in arch, we don't do anything in the lingual side, and therefore we can only do posterior melt, which I mean we can tip backward, 7 and 6, tip them backward first, and then it will create some space for the rotation. And this time you can confidently apply some power chain in between. Why? Because if you don't do posterior melt beforehand and you recklessly apply power chain in between, they will close up the spaces and the tools cannot be corrected successfully. And therefore, we use arch melt first to tip back 6 and 7, and then it creates some room for the rotation, and at this time we can apply power chain. And always remember, because the final ideal position of the bracket should be on the buccal middle of the tooth, and therefore we can change the bracket positions, with the correction of the tooth and to the buccal middle. And once you can bump the bracket on the buccal middle of the tooth, which is also we call the final ideal position, FIP, and then you can correct the tooth very, very easily and naturally and very simple. Okay, so without anything in the lingual side. Okay, and also for my students, I also teach them not to rush engagement of the arch wire. Why? Because for us initial case with a lot of rotation, you don't need to rush to engage the arch wire. You can use power chain to do the rotation first, to do the major derotation, and after all the teeth can be corrected mostly, and then you engage the arch wire, which is also very, very powerful and very useful technique I can share with my students. And the other technique we call cross-bite arch, which is also very useful, especially for the cross-bite patients. Okay, like this. And this cross-bite arch is formed by existence of the two stoppers mesial to canine. And as you can see, we deliberately enlarge the arch length. So with the two stoppers mesial to the canine, you can see the in-between squeezing up omega shape the arch wire. So with the restoration of this arch wire, as you can imagine, they will kick out all the anterior front teeth. So we can correct the anterior crossbite very, very easy these are 4 cases. I will show you what to do. Just like this, we use crossbar arch so we can correct the crossbar very, very easily and without any biturbo or some other occlusal spring or reasons. And the way we form a crossbar arch is like this. First of all, we will make the midpoint of the arch wire here for the distal side of the bracket here. And then we press the first stoppers. And then we do it again for the left side. And then as you can see, if you put both stoppers mesial to canine bilaterally, you can see the enlargement of the arch wire. And then we can tie them backward. As you can imagine, when you engage all the arch wires into the bracket slot, it can expand all the anterior teeth. So which is very useful and very, very easy application of the clinical treatment. Okay, just like this. So you can use this, Okay, now I want to show you how we do distalization in RH orthodontics. Okay, we do RH distalization by 2 ways. The first one is what we call stopper and open coil spring, like this. We use combination of a stopper and open coil spring so we can do distalization one-on-one. And most importantly, it is unilaterally. You can do it only one side. Okay. In the past, when I was a student, my teacher used to teach us, you can never do distalization one side. You have to do it bilaterally. But nowadays, if you can use stopper and open coil spring, you can do it one side. Just like in this case, we can do only one side distalization. Okay, it's only one side distalization. Just another case, we only want to, correct this tooth, and therefore we do distalization only one side, which is very, very easy and simple. You only do stopper and open coil spring, the combination. And the other way we do distalization with LHY is we can make use of the loop. Why? Because LHY is a very soft wire. So with the existence of the stoppers, you can enlarge the arch wire length, and therefore you can squeeze the arch wire like this. So we can use this technique to keep off the 7 very, very simply, especially unilaterally, only one side. So you can design a arch wire like this, and then we can successfully complete the distalization very, very easily. Okay, and talking about the treatment, okay, for the anchorage reinforcement, for a non-extraction case, if we do distalization and you are afraid of an insufficient anchorage design, and I always suggest that you can apply with an intermaxillary elastic like this. For example, for this is a lower case distalization, so we can apply a class 3 intermaxillary elastic to reinforce the anchorage. Very, very simple, right? Okay, so this is another case we do bilateral distalization. We want to move backward, both bilaterally, okay, the 7 and 6, okay? So you can see we only use stopper and open coil spring to move them backward. And when all the teeth can be engaged, and then we can use LHY to engage the arch wire into all the teeth. And with the expansion technique, you can see all the teeth can be corrected very, very easily. Like this. Okay, and for extraction cases, if we want to reinforce the anchorage design, especially for the canine distal drive, what would you do? Actually, in arch wire, just as I mentioned before, we can tie the 5 and 6 together to reinforce the anchorage, which we call tie together. This is the most simple way. Okay, but also we can use the stopper to prevent the 6 and 7 from going forward. So you can use a stopper here, which is also very easy. And the other way, we can deliberately bump the bracket slightly mesially tipped like this. And after leveling, all the crown can be moved a little bit backward, and which is also, in a sense, an anchorage reinforcement or preparation. Of course, you can also use the techniques that I introduced before. We call it posterior meow, which only, aiming at 6 and 7 for anchorage reinforcement, and it can offer the anchorage from the posterior. Offer the anchorage from the posterior like this. Okay. So, but what if you miss with extraction cases, just like this? Whenever, I think most of the doctors, they used to also implant to track the canine, but I don't suggest this. Why? Because whenever you use the implant, you cannot avoid the intrusive force, right? But for canine distal drive, it is a pure horizontal movement. So I don't really suggest that you use implant to pull canine backward, to move canine backward, which is not good. But Instead, you can use the implant to reinforce your anchorage to design a very good distalization, which I commonly use. For example, if you want to prevent fight from going forward, I use an orthodontic implant to reinforce my anchorage, and then I design stopper and open coil spring to do the distalization, which I can securely anchorage design without any anchorage loss. Okay, but again, I don't suggest this kind of application of the coil spring. Why? Because you will make the horizontal tooth movement much more difficulty because it will offer inevitably intrusive forces at the same time. Okay, so this is for your reference. Okay, I want to show you some other application of RH wire. Okay, this is a little girl, elementary school little girl. Hey, you can see in her oral cavity, we cannot see the 4.6 and 4.7. And this is her panoramic film. You can see there are impactions. But what would you do if she were your patient? What would you do? A little girl, aligners? I don't think so. But for RH, this is quite easy. Why? Because with RH wire, we do surgical exposure first, and then we engage RH wire into the piece, and then I do nothing. Every time when the little girl comes back and come for a recall, I just encourage her to have some hot water or to have some ice bar. With the change of the difference of the temperature, the oral temperatures, it can reactivate the RH wire. And with the change of the temperature, RH wire can be restored to a straight wire. And then with time, all the teeth can be brought up naturally. So every time when she comes back to my clinic, I did nothing. And you can see all the teeth can be brought up naturally. And we do a lot of some soft tissue removal, and then we close up all the spaces. I think this is very wonderful orthodontics, and which goes back to the fundamental of orthodontics, what we call tooth movement. So I don't think you can do this by aligner or some other treatment. So I think this is quite wonderful example when we use RH wire. And the other technique we use RH wire is just like this. We do it inside out. What I mean inside out is we do it this way. We can invertedly engage with RH wire to all the bracket slot. As you can see, because the original shape is exactly this, and when you invertedly engage all the arch wire into the bracket slot, what will happen? Like this, right? With the oral temperature, and you will reactivate it, and then it can do bilateral expansion very, very easily. Okay, so this is a clinical photo, and I want to correct a narrow arch form of the upper arch, so I use the inside-out RH wire to correct such kind of problems. And here, because there are some minor crowdings, I deliberately use a small section of open coil spring to create some more spaces for the leveling. Okay, so another clinical application is about buccal version. In the past, when we deal with buccal version, it is very, very difficult. My teacher used to teach us like this way, to fabricate a transparator arch first and have some two solder hook, and then we use power chain to correct the outverted the buccal version 7. But nowadays, because RH wire can do leveling and torquing at one time, and therefore the only thing you have to do is to choose the right bracket, and then you do leveling only. Okay, but what do I mean by the right bracket? Because I want to correct this tooth, right? So I want the most inner torque minus torque. So the bracket that can offer the most inner torque is the bracket for 3.7 and 4.7. And therefore, I deliberately bound the 4.7 bracket on tooth 2.7, and I bound 3.7 bracket on tooth 1.7. As you can see, with RH wire, if you engage it with the leveling and torquing at one time, you can correct such kind of problem very, very naturally, only with one visit. And then we can correct such kind of very, very difficult cases in the past, but nowadays it become very easy cases nowadays. Okay, so we still have some other cases like severe crowding with buccal version both sides, and you can only do the right selection of the bracket, and then the other thing you do is to engage the RH wire, and then you can see only with one visit the tooth can be corrected automatically. Okay, and in this case, I don't use any orthodontic implant because only by tied together, mostly we can complete our treatment to do a very successfully and satisfactory canine distal drive. And this is the way we treat such kind of cases. You can see very simple, very simple. Okay, and for the scissor spine correction is also the same. When we want to deal with scissor spine, we want to have the most positive torque instead. And therefore, we will use this bracket to make it upside down to change the torque from minus to plus 30, positive 30. Okay, so if you can do this, break it upside down and cut off the hook. Okay, and with the arch wire inside a little open coil spring, push it backward. You can correct such kind of tooth very easily. And okay, like this. And this another case, the same. We can bend the bracket back, upside down, and then engage the actual wire inside and with a little open coil spring to push it backward. And then you can change the position and correct such kind of problem very easily. Another case like this. Okay, scissor spine, but it's okay because as long as you use the bracket upside down and with arch wire engagement, you can correct it automatically and very efficiently. Okay, and another case like this. So whenever you see a molar, leaning forward like this, leaning lingually like this, you can just use the bracket upside down and use arch wire. You can correct such kind of problems very easily. Okay, so scissor spine is no longer difficult cases in arch orthodontic like this. Okay, you can only use the bracket upside down and with arch wire engagement, or you deliberately add more torque on the arch wire, you can correct such kind of problem very easily. And the other technical application is what we call offset. And offset is very useful. For example, I will show you. This is a case that the oral surgeon accidentally pull out the different tooth, and therefore he left wisdom tooth to me. Okay, so when we cross up all the spaces, we have to deal with the wisdom tooth. But as you can see, this is a crucial surface of the wisdom tooth. So how we correct this tooth? We have two texts. The first one is to move it inward, and then we have to bring it up. And therefore, I chose the bracket originally on the occlusal surface. Of course, I want to bang it on the buccal surface, but at this time, I can only bang it on the occlusal surface. And I bend arch wire into like this. It will call vertical offset. And then as you can see, gradually, it will bring this tooth inward and then be brought up, okay, like this. You can see, and then gradually the tooth move lingually, and then the buccal surface has been exposed. And this time I rebound the bracket to the buccal surfaces, and then we close up all the spaces. So this case can be successfully saved. Okay. Okay, we also use arch for a lot of expansion. For example, this is a case unilateral crossbite, and this little girl only comes to my clinic for 4 times. The first time is we use an open coil spring to create more spaces for this, and then we bang the bracket, and then with leveling height on the right side and loose on the left side, and then it will correct automatically. Very easy. Okay, so there's from a crucial view, you can see open coil spring here, and with some mechanical stress to stimulate this tooth. And then the second time we engage all the arch wire into all the teeth, and then with the expansion technique or effect from the arch wire, we can correct such kind of problem very easily, just like this. And this is a 2 years follow up. And also for impaction tooth, just like this. Okay, we do general anesthesia, GA, for surgical exposure. But the problem is we can only bang the bracket on the lingual side because we cannot bang it on the buccal side. Okay, but with the open coil spring, we can create some spaces for this tooth. And once we make sure that room is enough, have been created enough for this tooth, we can do the second time surgical exposure. And then we bang the bracket from lingual side to the buccal side. As long as we can bang the bracket on the buccal surface, as I mentioned before, with arch wire and tie it loosely, the wire can go posterior very smoothly. We can bring this tooth down very successfully, just like this. Okay, and this another case, just like this. The same, we bang the bracket on the impacted incisor, and then we create some spaces here with open coil spring. And then we do the second time surgical exposure to rebound the bracket. And then here is very important, although it is a rectangular wire, but as long as you tie them together as anchorage and tie all the way very loose on the right side, you can bring down this tooth. And we encourage this little girl to do more massage for the gingiva, and you can see the change. Okay, like this. We can still have a lot of cases like this. This is impaired canine located here. The same, you can see the bracket can be bound here, and then we will move the tooth backward. And then as long as we make sure the tooth can be brought out, we can use electric wire and bound it directly. Engage the wire indirectly, and it will bring out all the teeth. And this is another case, the same, impacted canine. And then first of all, we just brought the crown of the canine backward. And then once we make sure it is in the right position of the crown, and then we create some spaces for this crown, and then we do leveling to correct this kind of cases. Okay, so there are so many cases we can see the effective and successful and simple treatment from LH wire. Okay, so these are some crossbite arch for crossbite cases, very, very easily. And together with the combination of the class-free elastic, another cases, all the same mechanism. Okay, so we don't need any biterable or any other kind of, we only simply use two stoppers mesial to the posterior teeth, and we deliberately enlarge or lengthen the arch wire. Okay, lengthen the arch wire, and you can see all the teeth can be corrected very naturally. Okay, just like this. Only LH wire and no any biterable. And this is another girl skeletal, but we want to treat the skeletal problem as early as possible. And therefore, we also use combination of a crossbite arch on the upper arch, and together with the class 3, lower 3 to upper 6 intermaxillary elastic to correct. And only 1 week, we can correct this kind of problem very, very successfully, and with some stable result, treatment result. Okay, we also have a lot of feedback. And here I want to show you some of the clinical application of Kenko implant. And this implant is characterized with dual thread. As you can see, some thinner thread on the upper part and some wider thread on the lower part. Okay, and on top of this implant, we design a cap, which we call revolving cap. And with the revolving cap, we can minimize the number of the implant that we have to use. Okay, so for a new beginner, I suggest you choose the non-hole, small head, and stainless steel, medical stainless steel, and the dimension can go to 1.5 times 8 or 2 times 10. Okay, on top of this tooth, you can see we have a revolving cap like this, and we designed the 6 types of the cap, for different usage. Okay, and if you want to assemble the cap, it's very simple. You just push by your fingertip. Okay, just like this. I always use the Kenko implant for incisor intrusion like this. Incisor intrusion, especially for gummy smile patients, or for some patients that I want to, maintain the maximum anchorage. Okay, so for protrusion treatment, or for some midnight correction situation. Okay, but with this cap, what can we do, or what can we achieve? We can do retraction, and then we can change the direction of the intrusion. For intrusion, so you can minimize the number of the implant you have to use. Why? Because in the past, if you want to accomplish retraction and intrusion, you need at least 4 implants, right? But in this case, if we want to minimize the implant number, I only use 2 implants and together with my cap, and I can change the way the traction directions, so I can minimize the number of the implants. So this is the clinical photos to show you how we do this to minimize the usage of the orthodontic implant. And also we can, flexibly design our intrusion extraction directions. Just use the minimal implant. Okay, and there are some commercial package like this, and our handles. Okay, and these are 3 commonly pressed implant positions, like here 2 and 3 and 5, 6 and 6, 7. Okay, and for this we spread implant for IGC, infrazygomatic crest. Okay, like this. Okay, I will show you more in our courses. Okay, so this is a clinical photo. Okay, and clinical indications for implant, of course, you can design a lot of, situations. Okay, because the time limit, I cannot, show you very clearly, but I just show you some photos. Okay, so if you are interested in it, you can have some time, to dig into it. Okay, for midnight correction, something like this. Okay. Okay, for articular retraction or occlusal canting. Okay, and here are some invited lectures for AAO and for Thailand Western University, and for Mahito University, and this is for Cambodia, and for Malaysia, and this is in Seoul National University, and this is for Korea, KAO, and this is from Philippines. Okay, and there are some feedback from the convention. Okay, and this is the invited lectures in Austria in 2023. And this is last year in 2025 October. I got invited to Brazil to deliver my speech. Okay, and we also have some LH courses in Mandarin Chinese in Shanghai, and also aligner courses. And this is our tier group, and also in Taiwan. And every year we have our LH conference. We gather all the doctors. They really like LH orthodontics, and we share our treatment experience with each other. And in CMU, okay. And actually, our first course is in 2015. And special thanks to Wang, and she brought a big team to us. And so that's the reason why we can, establish such kind of wonderful CE courses. Okay, at that time we have doctors from Thailand and Philippines, and then we have some doctors from Malaysia, Singapore, Guatemala, and then we have more doctors from Cambodia and from Singapore. Okay. There are some course photos because we have some hands-on at the night of the courses. And here are also some feedbacks from the doctors who attended our courses. Okay. Okay, so but due to pandemic, because we cannot help us stop our courses. So I think everyone still hold a good, very terrible experience during that time. And these are some ceremony after our courses. Okay. 10 years has been passed. Okay, but in the end, I want to share with you, LH wire is a very, very good technique, and it can always bring me long-term happiness. Okay, and nowadays we are inventing our new bracket for LH. You can decide the tightness or the looseness only by one bracket, and I will show you when you are here. Okay, and if we have time, we can still share with you some of our aligner treatment, and especially how we incorporate our aligner treatment together with LH, which I mentioned what we call WA orthodontics. And the aligner we use is Lux Creo, and I will show you more, and we can have some hands-on or some deeper discussion when you're here. Okay, so here's our group photo again. And thank you very much for your precious time. And at the end of the mini course, I still want to put emphasis on our course is still June 24th to 26th this year. And our learning objective includes LH orthodontics and our K1 also implant and cap and aligner treatment. Okay, thank you very much for all your attention. And if you are interested in joining us for the course and to learn more about LH orthodontics, please contact Wayne. Okay, and here are our registration QR code, and you can take a shot again then for later registration. Okay, thank you very much for today. Any questions? I think time control is good, right? Yeah. Hello. Can I see here? It's this way, right? Okay. Hi, everyone. Can anyone hear? Okay, thank you, Dr. Kenko. Yeah, my pleasure, my pleasure. Any questions for tonight? I see so many friends here. Thank you. So any questions about LH orthodontics or anything that I can, put more comments or discussions? Any comments is welcome.
Doctor, if you have any question, you can ask Dr. Kenko.
Yes.
You can turn
please.
on the microphone. Yes.
No, you can talk. The microphone is open now.
Dr. Yo, please turn on your microphone. You can go to the line and tick on the mic. You can turn on. Yes.
Okay, for those who cannot join the seminar tonight, the CMU have record of the list, so you are welcome to distribute it to the dentists who will be interested about the course. And
Yes.
thank you for everyone to join us tonight.
So this is the end. Okay, so see you next time.
Dr.
See you.
Kenko.
Oh, yes,
Dr.
yes.
Kenko, yes. We have a lot of Thai doctors to attend this seminar
Thank you.
tonight. Yes, and then I think it's almost them. They are interested in your course.
Thank you.
Yeah, like Dr. Pacharapon and his team,
Yes.
Dr. Tanadon, Dr. Prel, Dr. Yong, and other ones. Yes, and Dr. Arwin, Dr. Rosides. This is all the friends in our country and nearby. Yes, I would like to invite all the doctors to contact CMU because you
thank
are
you very
very,
much.
very guest speaker.
Okay, please
Yes.
come and enjoy the food and the scenery in Taiwan and the hospitality, and then please come with your friends. Okay.
Yes. Dr. Yo, you would like to join the course?
Yeah.
Please come.
Okay,
Yes.
normally I didn't use the LHY because my technique that I learned, I usually use like the Y bending. So normally in the past I tried to use because one of my friend he graduated from the TMDU.
Oh yes.
So the Y is so soft for me. Sometimes when I try to, because I'm usually use the excessive force or a lot of force. So when I try to use like the light Y, I cannot control like that because I usually use the Y bending and talk and tip, and after that.
Yes.
But in Thailand they have the problem like when you put the braces, you put only one Y and they didn't come to see you anymore, and the teeth will alive. So in Thailand, that Y is maybe make the orthodontist don't have the job, you know. Because in Thailand when you try to when you they try to use the orthodontic treatment, they try to separate. Example, the first time $100 and next time is $30. You need to come to see every month to get the money from them.
Okay.
Yes, and sometimes I have learned this technique from the Chiang Mai University in Thonburi. They have like Dr. How can call them, Bunsiwa.
Bunsiwa, yes.
Yeah,
Yeah,
he's the
I know her.
director over there. Yeah, and I didn't familiar with this technique.
It's okay. It's
Yeah.
okay. Yeah. I can, if I can have a chance to share with you, I will show some of the secrets of LH wire and how to, use this wire very successfully with you.
Yeah.
Okay. Okay,
Or do
please
you
come
think
join us.
it's very good for me because I have like around 10 years experience to use, and it's very hard to change everything in all of my patients, because I have a lot of patients, like 5,000 of them or 10,000 of them. Every day I need to see 200 of them.
Wow.
That's why sometimes when we change some procedure, it feel very hard for me. Normally I use the technique like for the back technique or tweed technique or licket. I use the old fashioned technique.
Yes.
But I hope I go to Taichung.
Yeah, welcome.
You're welcome.
Yeah, I think the LH wires technique is one of the most wonderful technique in the wire orthodontics. You can come and explore more about it. Okay, welcome.
Yeah. Thank you.
Welcome.
Yeah, one thing I like to mention is the Kenko Mini School. when back on 5 years ago, it's just an idea. Now it's mature. It's a product now, right, Dr. Kenko?
Yes.
Yeah, that's a very good thing to know that.
Yeah. Thank you.
Yes. Yes, totally. I think it's everything new from you, Dr. Kenko. Yes, it's so really exciting. Is your sharing the presentation, and I would like to share all the Thai doctors to go to Taichung and meet
welcome.
you and listen your lecture. I hope all of them to get many benefits from you.
Yeah. Okay.
We will.
I will do my best.
Yes, other people, do you have any question? Yeah, I think maybe not. If you would like to ask the question, please contact me. And my name is One in Thailand. Yes, many people or can ask Dr. Pacharapon. It's from your friend, and other can meet me in the Facebook Kanapasin Anantiti. Yes. Okay, I think tonight we are enjoy your presentation, Dr. Kenko. Thank you very much.
Thank you. Okay, so see you next time. Bye bye.
Okay.
Bye. ขอบคุณนะคะ
Thank
ข
you
อบคุณ
for
นะคะ
coming.
ยังไงติดต่อพี่วันได้นะคะ เดี๋ยวช่วยประสานงานให้ค่ะ ขอบคุณค่ะ Hi, Wen. Thank you.
Bye-bye. Wang. Hope to see you soon.
Yes, sure.
怎么就
Wen.
还宕机宕的时候，然后结束那个宕机了。